Hi Bruce, my name's Libby. I'm a student physical therapist. Is it okay if I take a look at the bottom of your foot?
Sure.
Okay, great. So this wound is on the base of the first metatarsal head, which is pretty common for neuropathic wounds. It looks perfectly circular. I've measured it to be 3 centimeters wide and 3 centimeters long. And the depth is only a few millimeters, which means it's probably only partial thickness, extending maybe into the dermis a little bit. The color of the wound is bright red on the inside and then white and calloused and dry around the rim, which is not attached. And it's kind of raised a little bit because the wound is punched out. I took my applicator and I measured undermining of about 1 centimeter in this wound. As far as the outside of the wound goes, the foot is pretty dry and calloused, which is indicative of neuropathy. And the temperature is pretty normal, and the whole foot is pretty normal temperature. And since there's no odor or drainage, that means it's probably not infected, and that it's healing pretty well, probably in the proliferative stage of healing because of the pink granulation tissue or red granulation tissue with no necrotic eschar or anything like that. The pulses on the outside of the foot, so the dorsalis pedis pulse is a 2+, which is normal, and the posterior tibialis pulse is also a 2+, which is normal, so that doesn't indicate any arterial or venous insufficiencies. So I would advise this patient to keep looking at the bottom of their feet every day, moisturize the outside that's dry and cracked because that could lead to some cracking and further wounds in the skin. Other than that, I would say that it's pretty healthy.